If you have IT band syndrome, that pain on the outside of your knee, and you've been using the foam roll, you've been using it incorrectly this whole time. And let me show you why. First and foremost, it's because you've been trying to use it to smash the things on the outside of your leg. So a better use for this thing is this. So when we look at the facts, a foam roll can have very little to no effect on your IT band pain. Now, the reason you've been doing it is probably just because some PT back in the day told you to, or maybe because you've seen videos on YouTube and Instagram that tell you to do it. That doesn't make it a good reason. Now, you might find that you get temporary relief from foam rolling your IT band, but it doesn't fix the root cause. And the reason that it keeps coming back and back and back is because you haven't actually gone after the root of it, which oftentimes is single leg control. Specifically with running related IT band pain, that single leg control problem happens when your knee gives out towards the inside of the space between your knees. So if you want to get after the root cause of what's actually making this happen in the first place, try these exercises instead that are all aiming to try to get single leg control dialed in way better than before.